For what purpose does the gentleman from Montana rise?
I have an amendment at the desk, number 575.
Clerk will designate the amendment.
Amendment number 575, printed in the Congressional Record, offered by Mr. Rehberg of Montana.
Pursuant to the order of the House of February 17, 2011, the gentleman from Montana, Mr. Rehberg, and a member opposed will each control 30 minutes. The chairman recognizes the gentleman from Montana.
Thank you, Mr. Chairman. I ask for as much time as I may consume.
Gentleman is recognized.
Mr. Chairman, my amendment is simple and straightforward. This amendment denies any funding provided by this bill to be used by the department or agency funded through the Labor HHS title of the bill to support Obamacare. It will create a firewall so that funds from this bill cannot be used for that purpose. Obamacare included mandatory funding for several provisions normally funded through the discretionary appropriations. For example, $1 billion implementation fund. So unfortunately, resources will be available to Health and Human Services. This amendment can slow but not completely stop the process. I've tried everything within my power to write an amendment that would completely defund implementation, yet withstand a point of order. This is the best I can do today. I liken the situation with this bill to trying to drive a car to the moon. A car is the wrong vehicle for that purpose, but a car can take us on the first leg of the trip. It can get us to the launching pad, and I will continue to do everything I can to finish the journey. My goal, and the goal of the majority of Americans, is to repeal the new health care law. Until then, my objective is to defund it entirely and stop its implementation. It's impossible at this time to describe the many reasons that justify defunding and repeal. Let me begin with my belief that the law is unconstitutional. It runs contrary to our most fundamental concepts of limited government and individual liberty and responsibility. It's a law designed by those who wish to control every health care decision made by health care providers and patients, by every employer and employee, by every family and individual. It will control every aspect of 1/6 of our economy. This unaffordable program will cost $2.6 trillion in the first 10 years if fully implemented. 90% of that cost is for Medicaid expansion and insurance subsidies. Roughly half of the federal government's costs will be paid through new taxes, penalties, and fees on individuals and businesses. The other half is covered by cuts in Medicare benefits. The tax increases and regulatory burdens will be a significant drag on economic growth and job creation, and other costs to states, businesses, and individuals are not included in the $2.6 trillion figure. This is a job killer. How foolhardy. To create a new entitlement program when we cannot pay for the ones we already have and cannot meet our current operating expenses without borrowing beyond our ability to repay, this is madness. The structure of this bill is built on a foundation of multiple mandates. The individual mandate that requires people to purchase insurance whether they want to or not. Mandates on states to create and operate insurance exchanges and to expand Medicaid dramatically. Mandates on employers to provide insurance or be penalized. Mandates regarding the precise terms of insurance policies that everyone ultimately must purchase. And on and on. Our forefathers would be appalled to see the power over our health and lives that we are surrendering to government. They had firsthand experience with unfettered government control, and they carefully designed a constitution to limit the government's power. We've learned nothing from them. Never has there been such a complete transfer of power to our government, with such blind faith and hope that government will get it right, when our experience in every other context is so totally to the contrary. This is an experiment, a huge gamble imposed on us by those who did not read the legislation or fully understand its consequences. We're already catching glimpses of how government power will be exercised. Large corporations and unions have been granted waivers for mandates they cannot meet. Large corporations with armies of lawyers and unions who hold a special place in the hearts, minds, and political campaigns of those who enacted this bill. Will government be so accommodating to you? There are problems with the existing healthcare system, but this law only makes matters worse. The law must be repealed so that it can be replaced with incremental, market-oriented, affordable measures to improve rather than transform our current healthcare system. In the meantime, implementation must be stopped. There's a second reason to defund implementation. The law's individual mandate has been declared unconstitutional by 2 federal judges. Judge Roger Vinson has written a powerful opinion that strikes down the entire law. The administration and Congress are on notice of the substantial risk that the Supreme Court will uphold Vinson's decision. If that occurs after a year of more litigation, billions of dollars spent by the federal government to implement the law and by states, businesses, individuals, and taxpayers to comply with the law will have been completely wasted, thrown away. In light of the crisis created by our ballooning debt and anemic economy, it's fiscally irresponsible to go forward with implementation until the court challenge is finally resolved. For these reasons, I urge you to support my amendment, and I reserve the balance of my time.